Many of us know taking an ambulance can be expensive, even in an emergency situation. An Ohio surprise billing law that went into effect in 2022 is helping to bring down those costs for patients.
But a new study from The Ohio State University shows it could end up having unintended consequences. NBC4's Delaney Ruth is telling us why.
A new study from Ohio State shows just how complicated it is to protect Americans from surprise out-of-network ambulance ride bills. The study looked at a law that went into effect in New York in 2015, one that is quite similar to Ohio's surprise billing law. The surprise billing law in Ohio says that cost-sharing amounts are limited to a patient's in-network amount, which saves a lot of money, especially because many ambulance rides in Ohio end up being out-of-network and therefore more expensive. Dr. Wendy Xu, the lead author of this study, says this law has helped keep ambulance prices lower for Ohioans.
So you have the assurance of knowing it may still cost you a couple of $100, but it will be within the range of what your insurance plan would have outlined there for the in-network providers.
But Dr. Xu says a couple of years after that 2015 surprise billing law in New York went into effect, ground ambulance providers ended up raising their prices. She says that could very likely happen in Ohio and might lead to higher insurance premiums overall to make up for the ambulance prices.
So this is a very typical example of the policies with good intention that to protect consumers from the balance billing in emergency situations may have resulted in unexpected rises of healthcare costs.
Many of us have heard about or experienced expensive ambulance ride bills, and they can be detrimental. One man I spoke with today says his ambulance cost much more than he anticipated.
It's something that is not easily paid off with my kind of income.
And two women I talked to say they would try not to call an ambulance if they were in an emergency because of the cost.
For me personally, it is a factor that would make me not want to call an ambulance right away.
First and foremost, I'd rather seek a different option first, as like having a friend come or even an Uber, perhaps more so than ever reaching out for an ambulance.
Dr. Xu says the study showed that there is a lot more work to be done when it comes to surprise billing here in Ohio and nationwide. She said it's a difficult policy to tackle because there is no perfect solution. Local for you in Columbus, I'm Delaney Ruth, NBC4.